True or false? Sugar does not cause tooth decay. I'm going to answer that very shortly, but I'm going to say to you, it might be time to rethink some of the dental advice that we, as your dentists, have been giving to you and you have been following at home. I'm Dr. Rachel. I'm a holistic dentist with over 30 years experience. Sugar doesn't and can't cause cavities. What? How can that be? Am I mad? Have I lost the plot? Have I gone completely insane? Well, no, I haven't. Because the truth is, sugar does not cause tooth decay. No specific food causes cavities. But if you have a particular type of bacteria and you feed it sugar, then yes, you will get tooth decay. Without bacteria, sugar on its own will not rot your teeth. It's going to do some horrendous things to the rest of your body, by the way. You're going to end up with metabolic disease and diabetes and such, but sugar's not going to rot your teeth on its own. I am not saying that you should be indulging in sugar and giving in to those sugar cravings, but that we need to get the facts straight when it comes to what causes dental cavities. And the reason for this is, if we know the process of tooth decay, what causes it, then we know how to prevent it. And that then means that perhaps the advice you've been given by your dentist and the science behind brushing, flossing, and not eating sugar is misguided, inadequate, and insufficient to help you avoid tooth decay. Now, I'm not saying you shouldn't be doing those things. I am an advocate. Brush, floss, clean in between your teeth. Don't eat too much sugar. But how many of you, hands up, brush, floss, and don't eat sugar and still get cavities? Is that not just frustrating? Wouldn't you like to know how to not get dental decay? How to avoid having fillings every time you go to the dentist? So I'm going to go through what really causes tooth decay and why. We're going to look at the role of sugar and why toothpaste and brushing on its own is not the answer, and what other things you can and should be doing to strengthen your teeth and truly protect against tooth decay. It's those bacteria that cause cavities. So, would it not make sense that to prevent decay, we would need to not only starve those bacteria, so don't give them sugar in the first place, but look for ways to suppress or eliminate them, to create an environment in our mouths where these decay-causing bacteria can't survive or thrive. The bacteria that are responsible for tooth decay are called Streptococcus mutans. We're going to call them strep mutans for short because it's just easier to say. We're not born with this bacteria present in our mouths. It's not part of our natural microbiome. It's actually a communicable bacteria. That means we pass it from one another. We pass it from one mouth to another. Now, I'm not sure how this bug got into our mouths in the first place, but babies are essentially not born with it. So let's just pop that to one side for a moment and we'll come back to that. Let's talk about how cavities form. You need two things to get a cavity: strep mutans and sugars. If you have one without the other, you won't get decay. They have done experiments on this on rodents, and I think it was on dogs, where they eliminated all the bacteria. So they did one experiment: no bacteria, no sugar, no decay. Bacteria, no sugar, no decay. Bacteria plus sugar, decay. So it kind of said you've got to have both. That doesn't mean that you can go ahead and now just nuke your mouth and napalm your mouth with antibacterial to try and get rid of all the bugs. Because what you're going to do is you're going to destroy the balance of your good bacteria. You're going to harm your oral microbiome. And you need that to keep your mouth healthy. In fact, if we didn't have bacteria in our guts, we would die. We wouldn't be able to digest our food. We'd have no immune system. You need good bacteria. So don't just go out there trying to destroy all the bacteria in your mouth. That's not the answer. But the question I will pose to you is, can you try starving the bacteria of sugar? Now, this is certainly going to help reduce tooth decay, but you're still going to need to care for your mouth to avoid gum disease, as that's an entirely different group of bacteria and a totally different process to tooth decay. So don't just think, oh, she said if I don't eat sugar, I'm not going to get tooth decay. Then you stop eating all sugars and carbohydrates, and that means you can stop brushing your teeth. No, that's not true. You need to look after your gums as well. So how does strep mutans cause cavities and holes in your teeth? The strep mutans, they utilize the sugar from your diet. They produce a waste product, bug poop. Now that bug poop is high in lactic acid. And that acidic poop, yes, they're pooping on your teeth. It's not a very nice thought. That acidic poop, it contacts your teeth and it dissolves them. It literally leaches and sucks the minerals right out of them, causing a thing called demineralization. That makes your tooth porous and weak. Those minerals leach out to try and buffer and neutralize the acid. Now, if the bacteria keep eating sugar and pooping acid, your teeth keep getting demineralized until the tooth becomes so porous that the bacteria actually get inside the tooth, and this starts to destroy the softer inner section below the enamel called dentine, and then it rots and decays your tooth. At this point, you most likely need to have your tooth drilled and filled, as the damage has gone too far, and we need to remove that rotten tooth and seal the tooth back up. But if we can catch the decay process at the level of the enamel, we can actually reverse decay. The bacterial infection, we can stop the damage, we can stop you from needing a filling, and we can heal the decay. Yes, we can reverse the cavity, because at this stage the minerals have been leached out, but the shelving, the scaffolding of the enamel is still intact. And what we need to do is provide the right biochemical conditions, alter the environment, combat the acid as well as the bacteria, and then we can replenish the tooth with the minerals. We can restock the shelves, and we can harden the tooth and stop the demineralization. This is a process called remineralization, and our goal is to try and keep our teeth in a state of remineralization by keeping the pH, the relative balance between acid and alkaline. We want to keep that pH balance of the mouth at the level that supports the saliva to remineralize and repair the enamel. So if we can keep that tending to neutral or slightly alkaline, we're going to remineralize the teeth and we're going to stop the tooth decay process. But if you're eating sugar, demineralization is happening far too quickly, and the mouth is too acidic constantly, and we can't get those minerals back in. So let's think of your enamel like supermarket shelves. They're the scaffolding of the teeth, and if those shelves are kept fully stocked with minerals, they're going to remain as a barrier to bacteria, and you're not going to get decay. The demineralization, they're just looting. They come in, they strip the shelves bare, and this shows as an early cavity or a weak spot in the tooth, and we can especially see this on a dental x-ray. But because at this stage the shelves are still standing, they can be restocked and the minerals can be put back in place if we provide the right circumstances. This means you do not need a filling at this stage, and a full-blown cavity can be avoided and this weak area can be reversed. Now you might be wondering why I'm waving my arms like a crazy woman, and I'm doing that because I don't want you to get a filling at this point. Now many dentists, they x-ray and they go, oh my God, you've got a hole. Look, see here on the x-ray, you see a hole. You need to ask, excuse me, is that still only in enamel? If it's still only in enamel, You tell your dentist you'd like to work to remineralize that area and you don't want to have a filling just yet, because it can be reversed. I had some areas like that on my teeth. I was told when I was about 19, 20, I was going to need fillings. I refused because it was only an enamel and I've never ever needed to have them filled. However, if your enamel collapses, if it breaks away, if it chips or fractures or it caves in, then the shelving has collapsed, they're gone, and it can't be refilled with minerals. And if that happens, if that's the case, you will need a filling. We must have enamel structure left to put the minerals back onto to be able to remineralize the tooth. Okay, so I'm jumping around a little bit here. I might have gone a little bit too fast. So let me just backtrack a bit. Let's break it down for you, and then I'll go through ways in which you can remineralize the teeth and reverse the tooth decay. I'm going to link to another video for you as well. So no specific food, not even sugar, causes cavities. Cavities are caused by bacteria that feed on sugar. They produce acid that eats down through the enamel of your tooth. It demineralizes the tooth in a focal area or localized spot, and we call that tooth decay or a cavity. Now, the major tooth decay causing bacteria is Streptococcus mutans, strep mutans. Remember, this is a communicable bacteria. That's right, we give it to one another. Now, most people in the world have strep mutans or will get strep mutans. However, there's some very smart communities in the world where they know about this, and they specifically ensure that in families that they do not kiss their babies on or near the mouth, nor do they blow on their food, put utensils, dummies or bottle teats in their mouths and then into the mouth of the infant. They do this to specifically reduce the transmission of strep mutans. And it works because in these communities, they have very low decay rates. Back to how decay happens. Strep mutans lives in the mouth, and when there's sugar present, it eats it, produces the acid produces cavities. That takes teeth from a state of remineralization to demineralization. If your mouth is already in a state that's more demineralization mode due to factors that stress your body and make it more acidic or mineral deficient, like in the case of poor health or a poor diet, it's going to capitalize, the bacteria are going to capitalize on that, and it will cause cavities much faster. Don't forget that acidity is bad for the mouth. So acid in your diet and your drinks will dissolve and demineralize your teeth without the need for strep mutans to do it for you. Things like lemon, carbonated drinks, vinegar, and anything acidic in taste will soften your tooth enamel. And while you might not get decay, you will get erosion. You will dissolve away your enamel coating. If you were to have a zero carbohydrate diet with no sugar, no starches, you would reduce the opportunity for strep mutans to consume sugar, breed, and release acid. However, most people won't have a completely sugar-free, no starchy carb diet, and so we need to provide the right conditions to stop the strep mutans and the acid production. So to prevent tooth decay, it's twofold. One, we need to reduce the amount of strep mutans and therefore reduce the amount of acid in the mouth. And two is to provide the minerals that form the crystals within the enamel and some of the deeper layers of your teeth. These crystals form through a specific type of bond, and those bonds are very strong, but they are not indestructible. Your tooth enamel is the hardest thing in the body because of those special bonds. They're tough to pull apart, and in the naturally occurring mineral that's responsible for the majority of these bonds in the enamel in the teeth is called hydroxyapatite. This is a mineral of calcium phosphate. Now, you can get hydroxyapatite now in toothpaste and in mouth rinses, and that's going to help replenish that back into your teeth. It's a mineral that, by the way, has no fluoride. Your teeth are not made of fluoride or anything with fluoride in it. They're made from hydroxyapatite. However, fluoride is this chemical substance. It's not a vitamin and it's not a mineral. It's not essential nutrient to your diet. But studies show that it can replace some of the hydroxyapatite bonds in teeth and make these bonds hyper strong. But we can do the same thing with hydroxyapatite and calcium without the potential side effects and risks that fluoride poses. And I'll link to a video on fluoride as it's just going to take too long to explain that here. One of the issues we face due to our lifestyle, dietary, and even oral hygiene habits is that we have altered our microbiome. We have changed the types of bacteria in our mouth, so we have less good bacteria and more disease-causing bad bacteria that lead to tooth decay and gum disease. We need to essentially rebalance that bacteria, reduce the acids, cut down the sugar, and provide an environment that can remineralize teeth and keep the hydroxyapatite bonds strong. Now, things that disrupt your oral microbiome are things like alcohol, sugar, medication, stress, poor diet, dehydration, overly aggressive antibacterial mouthwashes, chemically laden toothpastes, excessive oil pulling, antibiotics, smoking, and breathing through your mouth. Anything that damages your microbiome is not good for your oral health. When the oral microbiome is out of balance, you're going to get an increase in bad bacteria, fungi, yeasts, and parasites. If your overall health and diet are compromised or deficient, this makes for a more acidic environment because it alters the pH of your saliva. It places your mouth and your teeth into a state of demineralization where your teeth are dissolving without the bacteria even doing a damn thing. Your teeth are weaker, they'll be more prone to decay, and your saliva cannot provide the defenses and minerals to keep the shelves stocked up and those hydroxyapatite bonds strong. The shelving will collapse, and now you have a cavity and you're going to need a filling. We need to address how to provide the environment that can remineralize the teeth and reverse the process of tooth decay by restocking the shelves in the enamel. First, we need to keep the mouth clean, remove any food from our mouth and in between our teeth after eating. This does not mean you should go and brush your teeth straight away. That's not recommended as your enamel will be slightly demineralized and softer, so if you brush straight away, you remove this softened layer. You need to wait 30 minutes before brushing, but before then, just rinse your mouth with some water and dislodge as much food as you can. Second, we need to limit sugary, starchy, and acidic foods and drinks to not create an environment that supports tooth decay. This means eating less of these things and also less often. It's the frequency of exposure that is more problematic because the more often you snack, you keep dropping the pH, you're making the mouth acidic, and you're not giving your saliva time to remineralize the teeth. This is why the advice has been to keep sugary things to meal times, so you aren't constantly feeding the bacteria and making the mouth acidic. Now, this is why I'm a huge fan, and for lots of other reasons, of intermittent fasting. It just gives your body and teeth a stretch of time where they do not have to deal with sugars and acids and digestion and all that thing. It gives your body time to create a lot of saliva that is the right pH to support remineralization of the teeth, provided that there isn't a lot of food or acidic liquids going into your mouth. We need a way to quickly combat the effects of the foods that we eat and alter the way strep mutans can utilize it. And a way to do this is to chew xylitol gum or have a xylitol mint after every meal. If you've got those metal silver fillings, I don't advocate the chewing gum. Those fillings have mercury in. Chewing on gum can release that mercury vapor at a higher rate. I've done a video on that, so you can check that out as well. So after every meal, have some xylitol. Strep mutans love xylitol. Xylitol is a sugar alcohol. Doesn't increase your sugar levels or insulin or spike anything like that. And they will eat xylitol. It's their favorite food. They're going to eat that over normal sugars. And when they eat xylitol, they don't produce acid. Xylitol also stops the bacteria from being able to stick together or stick to your teeth. And when they ingest xylitol, they can't process it, they can't digest it, and eventually they starve to death. Oh dear, that's a bit sad, but no, it's not really. They starve to death and you get less nasty bacteria. Xylitol also stimulates your saliva flow and that helps remineralize your teeth. Fourthly, we need to brush and clean between the teeth, remove food and disturb the bacteria layers on the teeth and gums, which is called biofilm. The more biofilm builds up and the longer it's been there, the more it will breed, the more bad bacteria there are, and the more poop of acid there is going onto your teeth. Stirring up that biofilm every 12 hours, so morning and night, that stops the bacteria from being able to group together for self-defense. 5. We need to alter the pH of the mouth, and we can do this with something like bicarb, baking soda. Now, instead of brushing your teeth with this, which can be too abrasive, I recommend mixing it in some water and just rinsing it round your mouth. After you've brushed your teeth with your toothpaste, you can actually dip your toothbrush in the water with your baking soda mix and just gently brush your teeth that way. Baking soda is very alkaline and it's going to combat the acid and help your teeth remineralize. 6. Your toothpaste needs to help reharden your enamel. Now, I recommend a natural toothpaste, one with hydroxyapatite in it, so you have all the building blocks to restock the shelves. Again, I'll link to another video on that for you as well. 7. Use a mouthwash that's alcohol-free and as natural as possible. A lot of commercial mouthwashes, especially those containing alcohol, are terrible for oral health. They disrupt the healthy components of your oral microbiome and they can actually be acidic. I encourage you to try and find a mouthwash that is not alcohol-based and is not a strong antiseptic. You want it to be more of an anti-inflammatory, antibacterial. You could do oil pulling instead with coconut oil. Now, you only need to really do that for a couple of minutes to get the remineralizing and antibacterial effects. Any more than that, and you can actually damage your oral microbiome. So these things are all things you can do at home. They all help combat bacteria and remineralize your teeth. So where does your dentist visit and the dentist fit into this? Well, if you have routine cleanings, we can remove the hardened layers of tartar that harbour the bacteria that can cause gum disease and put you at risk of cavities, and you can't clean tartar off by yourself at home. We can also identify demineralization and cavities, tell you how far they've progressed, and if you still have the chance to reverse them with remineralization or not. Then we can work with you to avoid having a filling or make sure things don't get out of hand and that you end up with a cavity that's going to go into your nerve and cause pain, and then you need extra treatment and expense when all that could have been prevented. As dentists, we should also be advising you on the optimum dental diet to help you resist and prevent tooth decay and remineralize your mouth. And I've done exactly that in this video here, so watch this now so you know how to eat to prevent tooth decay and remineralize your teeth.